Hello everyone, my name is Tiffany Hutchins and I am here to represent the Hutchins Association, an advocacy group operating out of the state of Nevada designed to campaign for legislations related to healthcare issues affecting the citizens in our state. The current policy on the table is the mandated use of electronic health and medical records, and we need your vote. These records are systemized collection of patient and population data with the ability to be shared, readily available within seconds, and printed off within minutes. Staff and patients alike have responded favorably to electronic health and medical records, so help us make this the standard by 2020. And for those not willing to comply, they will experience a 1% reduction in medical reimbursements for the first year, 3% after the second year, and unfortunately 5% after the third. At that time, their right to practice medicine will be on hold. As a part of the American Recovery and Reinvestment Act, all public and private sector healthcare providers and other eligible professionals were required to adopt and display significant use of electronic medical records by January 1st, 2014, in order to maintain their existing Medicaid and Medicare reimbursement levels. Since that deadline, the use of electronic medical and health records has spread worldwide, exhibiting immense benefits to health organizations and patients all over the globe. While usage has steadily grown over the years, we believe in this day and age, with so much personal information being leaked, that moving up the mandatory full implementation cutoff date is imperative. Based off of our research and experience in the healthcare industry, electronic health and medical records are the way of the future. While electronic health and medical records limit the amount of space needed to stage records and reduce paper waste, it is truly designed to protect the patient. This is proven by the fact it limits and monitors who has access to a patient's record, as well as reducing the risk of it getting lost or possibly damaged. For example, according to Boulos in 2013, written in 2013, in 2008, UCLA Medical Center terminated 13 employees for inappropriately accessing Britney Spears' medical records, who's a singer, by the way. Most recently, Cedars-Sinai Medical Center terminated 5 employees and a student research assistant for accessing the health records of Kim Kardashian, a socialite. Keep in mind, these employees were fired for just accessing medical records. Disclosure of information was not even a factor at this point. In fact, accessing records of others, even family members, is also prohibited and unauthorized use. A patient's right to privacy is a huge deal and has been since 1996, when the healthcare system finally decided to improve efficiency and effectiveness by creating the Health Insurance Portability and Accountability Act, also known as HIPAA. Another benefit of electronic health and medical records is the availability to forward important data quickly, like we mentioned before. For instance, if you were referring a patient to a specialist and they needed to review certain documents before seeing that patient, front desk personnel could email that information within minutes, rather than scanning a copy, faxing it, giving it to a patient, and possibly running the risk of losing it. Now, there are challenges, as with any new process or product you might have glitches, but we believe in this case the pros far outweigh the few cons. We're aware that challenges such as dealing with hackers could be a possibility, but we have plans in place and systems that will be embedded in the software that will prevent such an occurrence. We understand there may also be some other concerns, such as what happens if the software goes down. Well, we have 24-hour IT support. Now, if our IT specialists are unable to solve your issue quickly, you will be diverted to a standalone computer, which we plan to set up in every facility. The system will not be connected to the net, and new data will have to be backed up on a hard drive daily, but this will serve as your emergency precaution. Another factor that concerns people are costs. Well, I assure you, costs will be minimal. We suggest implementing a light schedule for small facilities to medium facilities, possibly a week. For large hospital-type facilities, we suggest up to 2 weeks. And having 2 to 6 staff members dedicated to scanning and uploading documents. Don't worry, we've averaged the time, and this will be made up within a month, as staff typically spend 1 to 2 hours a day searching for and filing records. The benefits, you wonder. Well, this includes many, like improving quality, safety, efficiency, and reducing health disparities. Another concern for healthcare professionals and leaders in the community are the effects on the business and the industry. Well, the benefits are positive. It streamlines business, therefore improving the medical industry. Not to mention the increase in job positions, from informatics specialists to consultants and managers. Something else that has been brought up were, how will the policy support health and productivity of state residents? Well, by elevating access and treatment, it would also enhance care coordination for the immediate population and public health as a whole, while maintaining privacy and security of patient health information. Now, if that didn't convince you, I really don't know what will. Electronic health and medical records are a must. I only hope we can count on you for your vote. Please contact me if you have any questions, concerns, or issues. Thank you so much for your time and your consideration. I look forward to hearing from you and talking with you.